the heart, we're going to do external anatomy of the heart first. Okay, so external or superficial anatomy. So if we look at the heart, the first thing we're going to see is the aorta, or the ascending aorta, where it comes up. Notice next to it you have the right auricle and you have the left auricle. If I open up the right auricle, inside is the right atrium. We'll look at that in a minute. So again, stay with external anatomy. Ascending aorta or aorta, pulmonary trunk. If we follow the ascending aorta, it comes up, and this curved part is the aortic arch. 3 branches off the aorta. The first one is always the brachiocephalic trunk, or you may call it the brachiocephalic artery. You have the left common carotid artery and the left subclavian artery. If I rotate this slightly, you can see the superior vena cava. The superior vena cava splits into the brachiocephalic veins. There's a right brachiocephalic vein and a left brachiocephalic vein. Staying with the anterior view of the heart, you see some coronary arteries. So we can see the RCA coming down below this auricle here, and the RCA continues until it branches and ends in the marginal, which is right on the margin or the edge of the right ventricle. Now, if you saw blue here, that would be the anterior cardiac vein. It's not on this model. Look at the torso model. Now I'm going to rotate it. Here's my left auricle. You see the little tiny, my fingernail was on it, LCA. Very, very short left coronary artery. It immediately splits into the left anterior descending artery, which you can just write LAD, or you can call it anterior interventricular artery. Notice the blue thing next to the LAD is the great cardiac vein. So I'm coming back up to the LCA, and again I have the split to the LAD, and now I'm following the split for the circumflex artery, wrapping around the lateral side of the heart, so you can see it underneath the auricle and coming around. If I stay with the blue vein, the great cardiac vein, notice that also wraps around with the circumflex, and the great cardiac vein comes all the way down where it ends at the coronary sinus. The coronary sinus is right next to the inferior vena cava. I'm going to flip it back over for another second. You can clearly see the apex here. If I flip it over, you see where my hand is the base. Stay on the posterior view, inferior vena cava, coronary sinus. This is the posterior interventricular artery, and right next to it is the middle cardiac vein. On this side is my posterior cardiac vein, and then over here you can see a little bit on the side and wrapping around is my small cardiac vein. You can still see the apex in this view as well. I'm going to move it slightly. We're staying with the posterior view of the heart, so you still see the superior vena cava, you still see the aortic arch. In a posterior view, you still have your 3 vessels. You have your brachiocephalic, left common carotid, left subclavian. Now, what you see here is the pulmonary veins. So this is my left atrium. If I open it up, I need to pause that. You see the left atrium. You can see the fossa ovalis inside. These are my pulmonary veins. So I'm going to have my right and my left. I have a right superior pulmonary vein, right inferior pulmonary vein, left superior pulmonary vein, left inferior pulmonary vein. I'm going to rotate it back to the front again. Pulmonary trunk, right pulmonary artery, left pulmonary artery. Let me do that. I just messed that up. Left pulmonary artery, sorry guys, right pulmonary artery. I'm going to come back to the front here, and you see the pulmonary trunk and the aorta, and that white thing is the ligamentum arteriosum. Okay, so just to make sure, because I said it backwards, pulmonary trunk, left pulmonary artery, right pulmonary artery. Now we're going to take the front off. You see trabeculae carnae pretty nicely here and here. Interventricular septum, some papillary muscles. The white threads are the chordae tendineae, and the cusp are the valves. So you might need to zoom in to see these real well. So on this side I have my tricuspid valve. I put it on the paper. On this side I have my mitral valve, my pulmonic valve, and now when you're looking for the aortic valve, you got to turn it. So I'm going to turn it and look up inside. You guys see that in there? For the aortic valve. Okay, so you want to look in there for that. What did I forget? You can pause it. I think that's it.